Hello, everyone. This is Leanne Bryan from the Subsidy Center. Get started here in just a minute. Katie is pulling up the slide deck. And I see we have 78 attendees. Popular topic today, error rate. I see folks are still trickling in, so we'll give it just another 5-10 seconds, and then we'll go ahead and jump in. We have a lot of content to cover today. Want to make sure we maximize this time together. All right, I see a lag now, a little pause and folks joining. So welcome. This is Leanne Bryan from the National Center on Subsidy Innovation and Accountability. We are hosting an error rate year 2 cohort call this afternoon, case review check-in, and frequently asked questions. So here are our error rate specialists at the National Center on Subsidy Innovation and Accountability. Hopefully at least one of these names is familiar to you, but that's Janae Broadway on the left. She is the error rate specialist for Region 7. That's me in the middle, Leanne Bryan. I'm the error rate specialist for Region 1. And over on the right is Katie Watts. She is our error rate lead here at NICSIA and will be doing most of the presenting today. I also want to take a moment to welcome the Office of Child Care Central Office staff, Adi Fator and Linda Winings. I believe you're both on the call today.
Yes, hello everyone. We wanted to welcome you on behalf of the Office of Child Care. My name is Adi Fator and I'm here with my colleague Linda Winings. We're program specialists with OCC's Oversight and Accountability Division. We work on improper payments and program integrity. So we only have an hour, so I won't take up too much of your time. We just really wanted to thank you for taking the time to join us today. We recognize that we have all faced a lot of unexpected challenges this year that have impacted our work. So thank you for continuing to share the situations and scenarios that you're encountering in the field. We really look to you as the experts, and it helps us refine our work and think about how to move forward. So without further ado, thank you for all the work you do with children and families and to protect the integrity of CCF funds. And I will turn it back to Leanne to get us started.
Thanks, Adi. We also just want to recognize real quickly that we know we also have some regional office folks on the call today. I was trying to scroll through the attendee list real quickly. I do see a few, but gosh, there's 97 attendees, so I'm sure I'm going to miss some. So I'm just going to say welcome. Welcome to the regional offices that are on as well today. So this slide captures all of our year 2 states shaded in blue. All year 2 states did accept, so hopefully we have at least one representative from each of the states. And we also have several year 3 states participating today. So more and more states are looking to do those real-time reviews. So you can see Maine, North Carolina, Wyoming, New Mexico, welcome. You all are planning to conduct real-time reviews, so this webinar will be timely for you as well.
And if you are a year 3 state that is on this call, but you do not see your state shaded in yellow, I apologize. I made this map a few days ago, and I know we've had a few other year 3 states sign up since then, but you are definitely all very welcome on this call.
Definitely. Thanks, Katie. All right, so here's our agenda for our time together today. We're calling this first portion of the webinar Frequently Asked Questions, and we're going to be digging into some scenarios related to the COVID-19 pandemic and how to handle sampling as well as case reviews with a couple different scenarios in mind. Next, sticking to the topic of COVID, we'll consider some logistics around conducting case reviews in this cycle. You'll also have an opportunity to ask us, as well as your peers, any other questions or challenges that you may have or maybe you're expected to have related to COVID. Then for the last part of our webinar, we're going to spend some time talking about the missing or insufficient documentation table or mid-table. You will need to complete that as part of your reviews. So we want to spend some time talking through that today. And then we will wrap up with some next steps for our year 2 states. Katie, I think I'm turning it over to you at this point, but correct me if I'm wrong. I'm happy to cover this slide as well.
Yeah, if you could quick walk through the timeline.
Sure. So again, this timeline is for our year 2 states. We have some year 3s on today, but this is the timeline for all of our year 2s. So your case review period started last October 2019 and just ended yesterday, September 30th, 2020. So those are the cases, the eligibility periods that you're looking at. The last day to submit your SDAP, the Sampling Decisions, Assurances, and Fieldwork Preparation Plan, is October 31st of this month. The last day to submit your record review worksheet is December 31st of this year. Then as you start conducting your case reviews and you're preparing your report, the State Improper Payments Report, or ACF 404, that is due next summer, June 30th, 2021. And if you should happen to need a corrective action plan, that is due within 60 days of the June 30th, 2021 date. And now I'm turning it over to Katie. Thanks, everyone.
Thanks so much, Leanne. Yeah, so before we launch into some of those scenarios or situations that Leanne mentioned, we want to emphasize here that each state situation will be a little bit different, and there won't necessarily be one-size-fits-all solutions. We recognize that the year 2 states and the 3s as well, I don't want to leave you out, are all at different points in the review process. Some are just getting started. Some, like some of the year 3 states on the call, haven't gotten started yet. They're, starting to plan for it, and that's awesome. And then we have other states that are well into conducting reviews. So sorry about that. Today's webinar is really centered around sampling and case review scenarios. So we're not going to spend time on creating the sampling decisions plan, the SDAP, and the customized record review worksheet. So if your state has not yet started on those, you might want to listen to one of our previous training webinars if you would like some training on that. And I'll share the link for those later in this call. But we think that no matter where you are in the process, you'll find the content of this webinar to be beneficial. The second consideration here is that we know that lead agencies have a lot of flexibility in how they operate their CCDF programs and in how they define errors. And this year, because of the pandemic, many lead agencies have used those flexibilities to help lessen the impact on child care providers and to make sure that families have continued access to care. We know many of you have made changes to requirements, requested waivers, or submitted CCDF plan amendments. So we will be talking through these scenarios to highlight some areas for your consideration, but many of the decisions on how to ultimately handle each situation will come down to your policies and any of those temporary changes you've made through amendments or waivers. So we have been getting questions about how to handle certain child care cases in the review. For example, cases paid for with CARES Act funds, care that was provided for children of emergency or essential workers, or cases where a provider was paid but the child did not attend for COVID-related reasons. Some of the questions have been whether cases should be included in the sample. Does the reviewer need to do anything differently if these cases are selected? And whether these payments in question might be errors or not. And right now in this slide, I want to focus on that first consideration, should the case be included in the sample? So to address this, I want to start with taking a step back and think about what we mean when we talk about the sampling unit. So the description of our sampling unit that you see here is taken right from the data collection instructions, and I will just go ahead and read it. The sampling unit is a case, an individual child, that was active during the sample month and for whom a subsidy payment was made for services that were received by the child during the sample month. And you can see I've bolded two parts of the description because we're going to expand on these a bit. So first, what do we mean by active? This one hopefully is fairly straightforward. When we say active, we mean that there was a subsidy authorized for the sample month for the child. The child must have been active, must have had a payment made for services during the sample month. So what do we mean when we say services that were received by the child? And I think a lot of times when we think of services, we think that that means the child is attending care, is, receiving care, physically present at the provider's location. But it can also mean just that the child was enrolled and payment to the provider was expected, regardless of whether the child attended. And this is particularly true. I know a lot of states do pay providers based on enrollment and not necessarily based on attendance. So with that in mind, let's hop into our scenarios. I know we do have a couple of questions, and I promise we will get to them in just a moment. All right, so let's take a look at, these are 3 scenarios that, again, we've gotten some questions about. In the first one, the child did not attend because the provider was closed due to COVID, and the provider was paid for the child. In the second scenario, the provider remained open, but the child did not attend, and the provider was paid. And in the third scenario, the child's quote-unquote regular provider was closed, so the child attended a different arrangement than usual, and both of them received the subsidy payment for the child. All right, so in all 3 of these scenarios, the provider or providers were paid. So because that payment was made for the sample month, each of these should be included in the sample. And specific to this last scenario number 3, if that case is selected for your review, you would need to make sure that both of the providers, both of the payments are included and examined. So then there's also the question of whether the payment in these scenarios should be considered an improper payment. And again, lead agencies have been able to adapt certain policies during the pandemic, and also the CARES Act provides some additional flexibility for lead agencies, including continuing subsidy payments to providers who closed, and continuing subsidies for a child that's not attending due to closures or for just health and safety concerns, or paying subsidies for a child that's receiving care from an emergency provider, or paying subsidies to 2 different providers for the same child in time of services. There is one caveat here in that lead agencies cannot use regular, so non-CARES Act CCDF funds to pay both providers for the same child in time of service, but CARES Act funds are not restricted in that way. So in each of these scenarios, I want to emphasize that the payments are allowable per CCDF, but they may or may not be allowable based on your state's error definition. Again, depends on how things are being implemented, what your existing policies are, and what's in your approved plan amendments or waivers. right, a couple more scenarios. These are more related to funding. I've already touched a little bit on the CARES Act funds, but we have had some questions just about whether cases paid for with CARES Act funds should be included. Now, these are considered CCDF discretionary funds appropriated under the CARES Act. So yes, they should be included in your sample. Now, in scenario 5, it's a little bit different. The provider was paid with other emergency funds. And when we say this, other emergency funds, we're referring to just anything that the state used specifically to pay for care for the children of emergency or essential workers. The actual terminology used will probably differ from state to state. So the question again is whether these cases should be included in the sample. And it comes down again to the specifics of your state. You'll need to determine the source of the funds. If it was just state-only funds, you wouldn't put those in the sample, for instance. But if they were CCDF or pooled with CCDF funds, then that case should be included. And then at the bottom here, we have a reminder that in the final report, the ACF 404, you will need to report all of your CCDF payments that were paid over the 12-month review period. So again, that would include those CARES Act payments to providers. All right, so I know I covered a lot in these slides. I'm going to stop and see, let's see, what questions have come up. Okay. I have a question that came in from Sarah Carnahan. Can you repeat what you said when there are two providers being paid? Yes, absolutely. Let me go back a slide. So here in scenario 3, we had, one provider was closed, one remained open. The child attended one provider, but both were paid. So these were both paid based on they were paid for the same child for the same time, the same services. And under normal circumstances with regular CCDF funds, that would not be allowed for two providers to be paid for the same child for the same time period, because obviously a child can only be in one place at a time. However, under the CARES Act specifically, that is allowed, particularly thinking of these scenarios where the child's regular provider is closed, so the child has to go to a different one. So if this situation comes up, then you would need to determine what was the funding stream here. Was it CARES Act? Was one of the providers being paid with CARES Act? Then it's okay. If both were being paid for with regular CCDF funds, that is still not allowable. Hopefully that answers your question. Let me know if you have anything else. Okay. So we got another question in from Reggie. In the 404, will we have to identify the CARES funds that were spent? No, you won't have to isolate those. You'll just be reporting on all of the payments that went out, together. Okay, now question from Shannon. How do we incorporate the PF in the ACF 404 question 7B, 8B, 11A, and 11B? So pooling factor. Thank you, Shannon. That was going to be my question for you. Yeah. So we can follow up with you on this because pooling factor is not my forte. I don't want to, get too into the weeds, but basically, you're going to be taking your dollar amount that would be you would be reporting for 7B, 8B, 11A, 11B, and just multiplying it by your pooling factor. So I think 11A and B are asking what the improper payment amounts for the overpayments and underpayments. So say you had $100 in underpayments identified and your pooling factor is 99, you would multiply that 100 by 99%. You can definitely follow up with me or Leanne afterwards if you have further questions. I'm impressed that you're thinking about the 404 already. That's still a few months away. But it's good to be thinking ahead. All right. I don't see any other questions, so I'm going to move on, but we will stop again for questions in a few minutes. In this slide, I wanted to share a few thoughts or considerations around those waivers and plan amendments. So I know we've brought these up a few times already. I've shared some examples of what these waivers might include: temporary increases in income eligibility, waiving of certain provider requirements, or changes to the eligibility period. And there are others, I'm sure many of you are familiar. And I mentioned here that any policy changes during the review period must be addressed on your customized record review worksheet. If you've already had your record review worksheet approved and you need to update it, you can certainly do that, but it does need to be resubmitted for approval before it can be used. And this should also be something that you consider for your sampling decisions plan if you haven't done that yet. There's a question on there about how the lead agency will ensure that current policy is being used in the reviews. So this is something that you will want to address in your SDAP. It's really important that these changes are being reflected and communicated consistently across trainings and in training documents, guidance to reviewers, as well as being included on the record review worksheet. All right, moving on. I just checked for questions and I do not see anything that we haven't addressed yet. So in this portion of the webinar, I'd like to address the logistics of conducting case reviews during this very unique time when many more of us than usual are working from home. And I will share some of the experience that the Year 1 states shared with us. They completed their reviews during the spring. And of course, if any of you on this call would like to share what's going on with your team, we'd be happy to hear that too. As always, we have our disclaimer that like everything else, your review logistics do vary from state to state. So we may say some things that are not necessarily applicable to your situation, but very basically, these are some of the logistical considerations that we deal with. A person who is conducting a review is going to need a few things. First, the case record, whether that's electronic, a paper file, or a mixture of both. And the reviewer will need to be able to access the record review worksheet template. And again, that template may be something that you complete on the computer, or maybe you do pen and paper reviews. And depending on your eligibility and review processes, the reviewer may also need access to certain systems, such as eligibility and payment or other external systems used for verification. So here are some of the challenges that you may run into, or maybe you have already run into these. These all came up with some of the Year 1 states and also heard from a few of the Year 2s. And we'll get into these more in the next few slides. Getting the case record can be a huge challenge if local offices are closed. Getting physical files or documentation to reviewers who are working from home can be difficult. And also, if the location of your reviews, if the reviewers usually travel to local offices and conduct reviews on site, that may not be possible right now. Let's dive a little bit deeper into the question of just getting the case record so you can review it. If this is an area where you think there might be challenges, we can break it down a little bit. First, figure out where the records are currently housed. Usually they're in local eligibility offices. Sometimes they're stored centrally or a mix. What's available electronically? In some states, reviewers never have to touch a paper record because everything is available in a system. Obviously, that's not the case everywhere. Sometimes we see that, you know, even within a state, in certain localities, the case records are all electronic, but in other localities, it's paper. And there's just so many different things that we see. So you'll need to determine what are you going to need, what is not available electronically, what do you need to get your hands on. Maybe certain things, you know, well, certain things are in the local offices. Maybe most of the case record is electronic, but you need some physical records for supporting documentation. So what would you do normally to access these documents? And from there, figure out what may need to be done differently this time around. And maybe you're not going to have any challenges in this area. I'm actually really interested to hear from the Year 2 states or the Year 3 states if you've had a chance to be thinking about this. Have you had to change the way that you access the case records during the review? Are there any thoughts around that? You can raise your hand or enter something in the question box. I'll just give a moment. In the Year 1 states, again, they completed their review in the spring. Local office closures were a huge issue. And I know that things are opening up a bit more in most states, so maybe this won't be as big of an issue for the 2s and the 3s. But again, I know that, you know, some of you have indicated that this is still going to be a challenge. So Kim in North Carolina said in North Carolina, everything is electronic. So glad to hear that that should not be an issue for your team. Great. Also, Teresa in Maine said that they're Maine's a Year 3 state, and they have files scanned so reviewers are able to have electronic access. Thanks for sharing that. Again, it sounds like this might not be an area where you're going to have challenges, so that's good to hear. For those Year 2 states, and don't worry, I'm not going to put anyone on the spot, but for the Year 2 states that are doing reviews, have any of you had to maybe do things differently from prior cycles? Okay, Reggie says that they have a new system in Florida that allows access to case files from the headquarters. So yeah, we'll see how easy or challenging it is to review cases when we start. Well, we're eager to hear about it and hope it goes well. Okay. Yeah, and just another thing to think about if you are just kind of getting started is that any changes to your process might impact your project timeline. So if, for instance, you are having staff in local offices maybe scan some files for you so they don't need to mail them or you don't need to send people out to get them, you might need to build in some extra time to account for that. And this was something that was specifically mentioned by some of the Year 1 states after they completed their reviews. obviously all of this happened kind of when they were in the midst of doing their reviews and finishing up their reports, so it wasn't really something that they could plan for. Okay. So let's see a show of hands. How many of you are in a state or in a team where at least some of your reviews will be done or are being done remotely, so from the reviewers' homes? So I do see quite a few hands being raised. Yeah, and I know that for most states, this is probably new territory. I know I looked at some of the old SDAPs from previous years, and reviews being done in home offices did occur, but obviously this year it's become more of the norm rather than the exception. So I wanted to share a couple of things that you might need to think about from a logistical standpoint. Of course, we mentioned already that reviewers will need to be able to access the case records and supporting documentation, whether that's through accessing your systems or getting physical copies of case files. And you'll also need to think about how will completed worksheets be shared with second-level reviewers and project leadership. So whether that means the reviewer needs to scan a paper worksheet, or if the reviewer will upload something to a shared location or email their completed worksheet to someone, you'll just need to have procedures set in place. And you probably already have procedures set in place from prior cycles, but they just need to be tweaked a bit. And this all kind of goes hand in hand with that second to last bullet I have here, and that's tracking the status of reviews. And just a really small example I've seen in states that maybe there's a piece of paper in the office and the reviewers will sign off when they've taken a file or sign off when they've completed a review. Obviously that can't be done if everyone is working from home. So again, just these little tweaks that you might need to make sure that you have those set procedures and that they're communicated to the review team. And I'm sure that, all of the review teams that are on these calls tend to be pretty awesome and on top of things, but just wanted to bring these up anyway. And this last bullet is extremely important: security. Just ensuring that electronic files are secure and that private information remains private. Our team at the Subsidy Center is actually working on a brief on this topic of remote reviews, and it expands on some of these points. So we hope to be able to distribute that brief to everyone soon. And also, remote reviews are not always a challenge. We had the project director from one of the year one states actually said that it made the process go by more smoothly because there were fewer interruptions. So those of you who are working from home probably have been doing this already for 5 or 6 months. So even if you haven't been specifically doing error rate reviews, you still likely have gained a good deal of experience with remote communications and meetings and dealing with IT systems remotely and all of that. So we really hope that your reviews go well. You can always get in touch with us if you have any questions or need some tips about, what will work for the specifics of your lead agency. Are there any things that the year 2 states, or again, the year 3 states, if this is something that you've gotten together and thought about, anything that you'd like to share on your experiences with remote reviews, any logistical considerations, things that maybe you didn't expect, or the good things? I will take a moment to see if anyone wants to share anything. Yeah. So Deborah, you pointed out that you're your 3 state, you're going to be doing real-time reviews, and you're in a situation where you only use those paper files, and most of the state are working from home. So yeah, you said you might have to be a little more patient when requesting files. Build that into your timeline a bit. Hopefully we'll be able to get our TA brief on remote reviews out to you soon. It might help a little bit. Arizona will be doing some of your reviews from home. Yeah, we see that sometimes, like a mix. It's not all 100%. Anna has the question, if you're completing case reviews that are all electronic, should we be saving a hard copy of the documentation? And I think that's going to be up to you and your review team. That's something you'll need to determine if that's necessary or not. I think we've seen it either way. Teresa from Maine, the review lead. Good to have good communication with the program lead. Yes, absolutely. Maintaining communication when you're not physically together in the office every day can be a challenge. Okay, and I do see one hand raised. Let's see. Hope, and your hand is raised. Would you like to, well, it looks like we can't unmute your phone, but if you want to type in your question, please feel free to do so. Otherwise, we can follow up after the webinar. Christina, I see your hand is raised. I'm going to unmute you, and you can see. I seem to have lost you, Christina. Did you have a question, or? Maybe not. Sometimes that hand raise button gets clicked accidentally. All right. So I do want to take one more minute, just in the interest of time. We're not going to spend a whole lot of time here. But are there any other questions, any other challenges, anything else that you would like to share about your reviews, whether it's directly related to COVID or not, just anything we haven't covered yet? I will take a minute to see if anything comes in. Otherwise, we will move on to the next part of the webinar. I do see one question. This is from Maria. Did I hear you say that it is okay to get the cases sent from the offices to you? In previous years, we directly pick them up. Yeah, it's okay to do that, to have case files sent from the local offices to you. Another option would be if the local office is able to scan the files into some central location, secure location. That's okay as well. I know that traveling out to the field is not something that folks may be comfortable with at this time, which we definitely understand. Yeah, you're welcome. All right. I'm going to move on to the next portion of the call, and as always, let me emphasize that if there are any other questions, please, you can email us after the webinar or put it in the evaluation. So we're going to move out of the COVID-related situations and scenarios and move into our mid-table training. So if you're a year 2 state that was starting on reviews back in the winter and you attended the February webinar on case reviews, some of this will probably be something you've seen before. And for the year 3 states that are on the call, you have some experience with the mid-table already because you would have used that a couple of years ago. So the mid-table goes hand in hand with what we call the additional inquiry. I'll be talking about the additional inquiry a little bit, but really we want to focus on the mid-table here. So to understand what we do with the mid-table, we need to have an understanding of the different types of errors that we look at in the review. So when a case file has an eligibility error, it'll fall into one of 2 categories. There's those that are caused by missing or insufficient documentation, or MID, as we often say. And then there are the non-MID errors, which can be caused by miscalculating income or applying the wrong copay, any other misapplication of policy. So then we have the MID errors, and those can be broken down further into 2 types. There are the errors that cause improper payments, and then the errors that do not cause improper payments. And we usually call these non-payment or administrative errors. And the non-MID errors can also be broken down into improper payment and administrative. So when we think about the mid-table and the additional inquiry, we're focusing on just this one type of error, the MID errors that cause improper payments or could potentially cause an improper payment. Again, I didn't want to spend too much time on the additional inquiry. If this is new to you, I can share some resources towards the end of the webinar that might help. And there's also a lot of information in the DCI, the data collection instructions. But really briefly, the additional inquiry it'll be new for the year 2 states. Again, the year 3 states did do this a few years ago. But it's a process by which those MID errors potentially causing an improper payment can be mitigated for this review. And they can be mitigated if you can find the missing information through accessing state resources that are not included in normal eligibility procedures. So I've bolded a couple of things here. When we say state resources, that refers to agencies that are within the state but outside of the lead agency. And not included in normal eligibility procedures. This means that it's something that workers do not normally access or consult with during the eligibility determination. Like everything else, the specifics of how the additional inquiry might work is going to differ from state to state, depending on what your normal eligibility procedures are. A lot of states have these really nice systems that are fully integrated with other programs. They have shared screens with other assistance programs. So those would not be able to be used for the additional inquiry because they are something that workers have access to already. Maybe there's other resources they can tap into to do an additional inquiry. Some states find that they just aren't able to do any additional inquiries because just everything is shared already. There's not really any other place they can go to find that missing information. However, if you're a state that does not currently have shared screens, that might be an option if you can access some electronic information for the review, then those could be used for an additional inquiry. This is kind of the gist of what we're talking about when we say additional inquiry. Now the mid-table, and I think that was included in the handouts that I emailed everyone, or it's also in the handouts box in GoToWebinar. I did send out the mid-table template, but this is part of the record review worksheet template. It's like at the very end of the template, and it'll be used to record some data on those mid-potential improper payment errors, regardless of whether the additional inquiry is used. The table is broken down by element, as you can see. So you would complete the row, enter the data for the element in which the error was found. So I'm going to show a few examples where we'll figure out if the mid-table should be used, and if so, how would it be filled in? Actually, really quickly, I want to stop and ask my fellow presenters, are there any questions that have come in that you think should be addressed now, or can we wait a bit?
I believe we've only had one question come in related to AI, and you already answered it. Actually, another one just came in from Amber Stevens. What if a worker has shared access and uses this to post income to the customer's case, but there's a piece of information that they would have to call the other agency to clarify, and they didn't do this? Would AI be appropriate?
Yeah, Amber, why don't we follow up after the webinar? It's a really good question. I just have would like to get a little bit more information. It sounds like at first glance that it sounds like a situation where maybe an additional inquiry could be done, but I would like to get a little more information. So we'll follow up. Hope that's okay. Just write a quick note down. All right. We'll stop again for questions in a couple of minutes. But I wanted to show some of these examples. So in the first example, there was a missing page from the child care application in element 100. There was some information missing, but nothing that would make the case ineligible. According to the state's policy, it's an administrative error. It would not result in an improper payment. So the reviewer should not complete the mid-table for this element. There was missing documentation or insufficient documentation, but it was an administrative error only. The next example is in element 400, which deals with financial requirements. So the client's income information was missing from the case file. The reviewer contacted the eligibility contractor, who provided the reviewer with those missing pay stubs. And the documentation was sufficient so that the reviewer determined there was no error. So this is not considered an additional inquiry because the documentation wasn't really missing. It was with the eligibility contractor all along. It just didn't make it to the reviewer. So similarly to the last slide, the mid-table would not be completed for this element. In example 3, in element 100, the reviewer found that the entire child care application was missing. So according to the state's policy and error definition, this would make the case ineligible. So this is what we would say is a potential improper payment error. The reviewer might think about whether an additional inquiry could be conducted, but since the application is unique to the child care program, that's information that can't really find elsewhere. So no additional inquiry was done, but the reviewer would need to complete the mid-table for this element. So how would we fill in the mid-table? When there is no additional inquiry, then the reviewer would only complete columns 2 through 5, and columns 6 through 9 can be left blank. We always say that you don't need to write a book here in the mid-table. In column 2, asking what was missing or insufficient, just give a few words or a sentence about what was missing. In column 3, you're going to give the amount of the potential improper payment error. In most cases, this is going to match the amount of the payment that was made for the sample month. Sometimes we find mid-errors that are only partial payments, but that's pretty rare. In column 4, we're asking, can an additional inquiry be conducted? Yes or no, we're going to code 0. And then in column 5, give a short explanation about why you aren't doing an additional inquiry. And here we'll just say that the application was unique to the child care program. In our next example, we're going to go back to element 400 where we have missing income information. Let's say that this lead agency does not have shared screens with other programs and that the reviewer is able to determine that the client also receives SNAP benefits. So they contact the SNAP agency, and that agency was able to provide the missing pay stubs. So this is an example of an additional inquiry. We had a potential improper payment error, but it was mitigated by finding that missing information from the SNAP office. We're still going to say that there's an error, but it's not an improper payment. So because there was that potential improper payment here, the reviewer must complete the mid-table. So let's take a look at that. When there was an additional inquiry done, the reviewer must complete all of the columns for the element except for column 5. So in column 2, we had missing pay stubs. In column 3, we gave the amount of the potential improper payment. In column 4, we're going to code 1 because yes, there was an additional inquiry that can be conducted. In column 6, describe briefly what you did for the inquiry. And we'll say that we contacted the SNAP worker. Column 7 asks whether the improper payment was mitigated. We'll code 1, which means yes. Column 8 gives the amount of the improper payment that was mitigated. And finally, in column 9, describe how you determined that the improper payment could or could not be mitigated. So we'll say here that SNAP was able to provide the missing income information. Okay. We have one more example, and this one is a bit more complex, so I'll try and go through it. Hopefully not confuse anyone, but this is a, yeah, go ahead.
Would you like to answer some of the questions that came in for the previous example before we go into this one?
Yes, indeed. Sorry.
Oh, no problem.
Okay, let me look.
Starting with Reggie Williams.
Yeah, so if an additional inquiry is done and it's determined that there is no improper payment, would the finding then be removed? So there would still be a finding, but it would kind of turn into just an administrative error. And then a question from Carol, which I think is somewhat similar. Would element 400, if there was a successful additional inquiry, would 400 be coded in error or not? So it would still be coded with a 1 for error. But again, there's no improper payment. Okay, and I also see another question from Anna in Michigan, and I am going to follow up with you after the webinar, Anna, okay? We can definitely walk through that. Did I get everything, Leanne?
Yeah.
Okay. So let's start with the same error from 400, the missing pay stubs. Let's say that there are shared screens with other programs and that the necessary income information can be found in that system. So what happens next is going to depend on what your policies and error definitions are. I'm going to share the different possibilities here. It's possible that the lead agency will consider the shared system to be acceptable verification for income so that there's no improper payment, but there's still an administrative error. So that would make this similar to, I think it was example 1, where we say it's an administrative error only. The reviewer then would not complete the mid-table. Similarly, it's also possible that the lead agency, again, according to their error definition, would consider that shared system to be acceptable verification and that there's no error at all, not even an administrative error. So again, the reviewer would not complete the mid-table here. But the lead agency, a different state, according to their policies, may also consider this to be a potential improper payment error because, again, their policy requires that physical verification to be present in the case file. Now, the reviewer may be able to complete an additional inquiry, not using those shared screens, but maybe there's some other source they could use, or maybe that inquiry is not possible. But either way, with this lead agency, the mid-table would need to be completed. So to recap, the mid-table must be completed when there's an error in an element that's caused by missing or insufficient documentation, and it would result in an improper payment. And remember, you would complete the mid-table regardless of whether there is the additional inquiry. Oops, sorry. And the mid-table is never completed for those errors that are only administrative errors or non-mid errors, or if that missing information is able to be mitigated internally, such as in the example where the reviewer contacted the local eligibility contractor. Here are some special scenarios that you may come across in using the mid-table. Thankfully, we find these are pretty rare, but we do want to quick address them. Included in the handouts is a brief on using the mid-table, which addresses, I think, this first scenario, and it also gives lots of other information on the mid-table, so you can take a look at that following the webinar if you would like. So first, you might find that more than one element in the same case has a mid-potential payment error, and you would need to ensure here that the mid-table is completed for each element with an error. But when you total the amount of the potential improper payment and the amount that is mitigated, if any, you want to make sure that you're not like adding up what's in the columns, but it's representing the case as a whole. And so if you run into this, I would recommend you look at that handout, or you can request TA on this or any of these. And second, there might be multiple mid-potential payment and potential improper payment errors in the same element. So for example, maybe in element 100, there's an application missing, there's also a certificate missing. You're allowed to edit, I guess, the mid-table template a bit for this. For example, you can add a second row for the element if you're working in Excel, but at any rate, you need to examine each error separately. Maybe you could do an additional inquiry for one, but not the other. Maybe you determine that, you're not going to do an inquiry for either because no matter what, the element's still going to have an error. I don't know, but you do need to at least fill out that mid-table for both. And finally, you may find that you can only partially mitigate the mid-error. Again, we do ask that you reach out to us if you run into this so we can give you some TA on not only completing the mid-table, but also because it will come up again in the final 404 report. All right, I know we're almost out of time, but here's some next steps for the year 2 states, and some of these apply to the year 3 states as well. Here's some deadlines. If you've not yet submitted your SDAP, that needs to be done by the 31st, and that is submitted in the OLDC system. A reminder that we can review drafts before you do the formal submission. After you've started reviews, you can send us a couple of completed worksheets so we can make sure you're on the right track. We really, really encourage this. And on this slide, we just give some other TA resources. You can see on the top right, I give the dates for some of our previous webinars. That one on the bottom has a lot of information on conducting the additional inquiries. So if you would like to learn more about that, you can access the recording or the slides for that webinar on, through the link that you see there on the left side of the page. One other thing, I know we're almost out of time. One other thing, if you can, I'm going to actually launch the poll right now. We are thinking of putting together a mid-table work group where we can kind of get some input from states on how the mid-table is, working out, how they're using it, what, getting some extra TA, what might we do differently to make the process a bit easier around the mid-table or additional inquiry, because we are getting close to the time where we need to make updates to the data collection instructions. So if you can just, answer the poll, we'll take your name down if you answer yes, and we will try and get something set up soon. You can also, I think this question is also going to be in the evaluation for the webinar. That's going to pop up as you close out. So you can provide an answer there as well. But I guess if you provided an answer in the poll, you don't need to do it in both places. Next webinar for the Year 2 states is probably going to be around spring of 2021. We may decide to do one a little bit sooner. For the Year 3 states, we're looking at winter of 2021. But you always please reach out to us for any TA before then. And here's our contact information. And I know we're a couple minutes past the hour, so I just want to again say thank you so much for joining us this afternoon. I hope this webinar was helpful, and we are really looking forward to working with all of you in completing this process. Any closing words from the others?
Thanks for attending, everyone. We appreciate your feedback on the mid-table work group as well.
Yeah, and if you did submit a question that we didn't address, don't worry, we will definitely follow up with you. So, all right, have a great
technical assistance.
Yep. Thank you, Leanne.
You're welcome. You're welcome.
All right, enjoy the rest of your day, everyone. Take care and stay safe.
Thank you, everybody.